Hello everyone, my name is Raymond Abinahar and I'll be talking about the Supplemental Nutrition Assistance Program, also known as SNAP. Now, SNAP is the largest food and nutrition program in the United States and is formerly known as the Food Stamp Program. The goal is to alleviate and treat food insecurity, and while the main objective is to reduce food insecurity, it also tries to promote and improve children and families' health. SNAP is an entitlement program, meaning that anybody who fits the requirement is eligible to participate. The requirement is the person has to make less than 130% of the federal poverty level, and they also factor in other income sources, assets, and cost of living in the area. Foods are purchased through electronic benefit transfers, also known as EBT. Now, SNAP has several benefits that impacted public health. SNAP reduced food insecurity, and what food insecurity is the consistent lack of access to food due to a lack of economic resources that prevent a person from living their active and healthy life. SNAP in 2018 decreased food insecurity by a rate of 30%, but in 2018, 11% of U.S. households were still food insecure. SNAP also improves health. New SNAP participants have increased health, better adherence to medication, and will use free community food resources. Children and adolescents also benefited by having reduced risk of developing metabolic syndrome. SNAP benefits the economy. Food insecurity costs the United States $167.5 billion a year, and this is due to healthcare costs, criminal justice services, emergency food assistance, and educational attainment. The program's goal helps reduce this by reducing food insecurity. Domestic products also increase in worth through SNAP. Every $1 billion in SNAP benefits becomes $1.5 billion in gross domestic products. SNAP can also help improve an individual's socioeconomic class. In 2017, SNAP raised 3.4 million people out of poverty, and it was ranked the third effectiveness in reducing poverty. There's also health disparities among the food insecure population. The statistic above shows that Hispanic and non-Hispanic black children are more likely to be food insecure compared to non-Hispanic white children. Disabled children are also twice as likely to be food insecure compared to non-disabled children. The statistic below shows that food insecurity is relatively equal between boys and girls and among the different age groups. A current issue with SNAP is the lack of health regulation of what participants are able to buy. The criticism is that SNAP doesn't promote healthy diets or healthy eating behaviors. It's important to note that SNAP participants' diets are not different from other consumers. They have the same diets of meats, dairy, sweets, and other macronutrients, and their consumption pattern of fruits and vegetables are the same as well. They are different in micronutrients, with SNAP participants consuming less vitamins, iron, and calcium. Experts and members of the public claim that SNAP should do more to promote healthy eating by limiting eligible products to only healthy options. A recommendation for SNAP is to make the information easier to access. It was difficult to find a website that offered a proper description of the eligibility requirements, and it was overwhelming navigating the government websites. Another recommendation is to educate SNAP participants about healthy eating. The program should teach the difference between healthy diets and an unhealthy diet. This was my presentation for the Supplemental Nutrition Assistance Program, also known as SNAP, and thank you for listening.